Welcome to another episode of Cutting Edge Health. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician that helps patients be able to understand how to be able to deal with pain, whether it's physical or mental, and how to be able to punch pain in the face and get back to leading the life they deserve. Today, we're talking about peripheral nerve pain and why it's a completely different monster than what traditional pain happens to be. Many people, when they think about peripheral nerve pain, they think about sciatica, and they are not the same thing. They're completely different. So when we think about what is peripheral nerve pain occurs when the peripheral nerves are damaged or destroyed, and they can't send messages from the brain or to it and to other parts of the body. So in this picture, you can see in white, you can see the central nervous system is present, the brain and the spinal cord that's in place. And then blue, you can see these elements that are present of the actual nerves that come out and come down. So when we take a look, we can be able to really kind of delineate that there's a difference clearly between the different parts of the nervous system. So what does that look like when we start talking about nerves as a whole? Well, the nerves as a whole that sometimes we will talk about intervening on, it could be things as plentiful as greater auricular, facial nerve, ulnar nerve, median nerve in the wrist for a carpal tunnel, radial nerve, obturator nerve, sciatic nerve, peroneal, tibial nerve. So all these various different nerves. And I know it seems like a lot, but bear with me. The reason why this is important is because sciatica, that shooting pain that we sometimes get down the leg, which we'll talk about differently on a different day, comes from the nerve root that's present in the spinal cord. And although it has similarities, peripheral nerve is different, and it affects a lot of people. So millions of people have that persistent pain, that burning, that tingling, numbness, a loss of strength, and a loss of balance. What's the percentage of people it affects? Well, 50% of people who have diabetes have peripheral neuropathy. 8% of those greater than 55 years old, almost a little bit more than 1/3 of those individuals who are greater than 80 years old have peripheral neuropathy. And 46% of people who have chronic alcoholism have peripheral neuropathy. So when we shake and split this out, then what does this look like in terms of most of those diseases? The most common disease is diabetes. 60% of patients who have peripheral neuropathy have some form of diabetes. However, and this is an interesting point, 23% have an unknown diagnosis as why they're having this nerve pain, which is really a challenge. For many pain patients, they feel like, hey, I present myself, I'm going to see someone and I can't get an answer and people don't believe me. And one of the reasons why they're not believed is because people can't find the answer to it, right? So let's talk about the different components of the nerve, and all these different types of nerves can be impacted in a negative way for peripheral neuropathy. So one is that motor nerve. So motor nerve is normally thought of, this is going to be some type of like palsy or stroke or something along those lines. It's what lets us be able to walk, catch a basketball, be able to move fingers. But sometimes these very same nerves can be impacted from a peripheral, traditionally through trauma, but can occur and have an issue with peripheral neuropathy. Secondarily, can be sensory nerves, where it's the aspect of perception, where you can be able to tell if something sharp, rough. We can see proprioception, where your body happens to be in space. And then finally, autonomic nervous system, which is probably one of the ones that's most complicated and probably least understood, where you can have changes in the heart rate, the blood pressure, your digestion, your sweating. These are the parts of the nervous system that control things that are part of our normal body makeup that we don't actively have to think about, but our nervous system does on its own. So when we take a look at this, how does that kind of like compare to traditional definitions of neuropathic pain, which is just nerve pain in general? Well, one of the things that we see is that it's normally poorly localized, it's deep-seated, it's a pain that's out of proportion to what you would feel from like an injury, like a cut or a bump or something like that. There's soreness, there's numbness, there's an electrical shock, and a sensation of cold or heat can affect the area. So when we talk about what are the different reasons and rationales for it, it's plentiful. plentiful, which is one of the reasons why this is definitely different than sciatica, right? So some of the symptoms as mentioned is this glove sock kind of sensation that's present in over the hand, in a glove distribution, or a sock over the foot. There's a burning sensation, there's freezing pain, there's sensitivity to touch, there's loss of balance as mentioned, muscle weakness, muscle cramping, difficulty walking, and many people would think that that might be stenosis or radiculopathy, but not necessarily. It can certainly be peripheral neuropathy. We're going to run through a few different diagnoses for people who have interest, so we can kind of get further understanding. It can come from an alcohol use. It can come from autoimmune, chemotherapy, diabetes, hereditary disorders, an unknown reason. It can also come from inflammation, from kidney disease, from certain prescriptions, which we'll talk about later. It can come from toxins, a vitamin and nutritional deficiency, which we also will discuss, physical injury and trauma, as previously mentioned. Many people who are in the medical field, they're like, oh, okay, if it has peripheral neuropathy, then it's always diabetes. Okay, let's give you something else that I think many people wouldn't know. So if you have COPD, where you have a lung issue, right? You have a decrease in oxygen, which is hypoxia. You have hypercapnia, which is an increase in CO2 that can occur for a number of different reasons. So you can have issues like smoking, metabolic disease, cardiovascular disease that are resulting because of this. But what happens is you can have problems and changes with the blood vessels, which cause for you to have poor perfusion, which is hypoperfusion. You can have oxidative stress that is caused from the issues with the aspect of the lungs. You can have a pro-inflammatory state, and you can have hyperglycemia because of this oxidative stress. So in essence, you can have neuropathy from COPD without incidence of diabetes, and you have this nerve pain, which is like unexplained. But if we didn't really kind of go into it and look into what might be some of those causes, those are things that we just wouldn't know. On a molecular level, there's a lot of different reasons for it. And as you guys know, I love to be able to include science so that people can understand. We're not just making this up, and that people can really be able to kind of hone and get into it so they get the gist. And I want you to be excited. But I know sometimes when we talk about the science component, it can get a little bit boring. But let me kind of precede this with the following. And that is, when we talk about these science components, these are the ways that we learn how to be able to do different types of treatments other than what's always been done. So what we can see is the spinal cord that's present. We can see the areas of the dorsal root ganglion and the dorsal horn and how they relate to the skin and how they relate to the muscles. What we know is that there are certain areas of central sensitization and peripheral sensitization that are accentuated by certain molecules and certain channels. So when we continually look at this and we think about, for instance, the aspect of diabetes and how neuropathy occurs, we can look through and see that there's multiple different pathways, which I won't take you guys all the way through. But as we just mentioned, there's things with circulation, there's things with inflammation, there's elements of oxidative stress. And all these things can be targeted by going after them in a different way. So let's take a step back from the fancy science stuff for a minute. And let's say that you or someone you love, you think you may have peripheral neuropathy. How would you go through knowing how to be able to assess it, evaluate it with the help of your healthcare provider, but also knowing for yourself? Because that knowledge, that's the quote, the old school ABC, knowledge is power, right? So let's kind of like take a look. So let's say you come in and you have this distal numbness, tingling, pain, and weakness. What we normally are going to kind of assess is this in one area? Is it equal on both sides? Are there other issues where there's problems with speech or vision? If that's the case, then we think it might be a central nervous system, and we need to kind of look for that into imaging. That's what's indicated by looking for lesions. If it's asymmetrical and there's falls or other things are going on, or paresthesias, meaning the shooting pains, this could be something like sciatica or nerve root compression or radiculopathy. However, if we think that it is peripheral neuropathy, one of the things that we're going to do is get a full examination, but we're also going to do some lab tests. We want to see if these lab tests kind of prove out and give us some insight about what's actually happening. And so those lab tests are going to be things that then give us an idea about what is going on, and do we need to do something like an EMG, which is an electromyogram, to be able to kind of assess, do the nerves work well? So is it an axon problem, which is a portion of the nerve? Is it a demyelinating problem where portions of the myelin, which are covering of the nerves, have an issue? Is it normal? And then we need to be able to kind of assess and evaluate. Is there problems with it being an issue of a mixture of either of these things? And how we kind of assess and evaluate that can be a number of different ways to be able to kind of like get clarity about that. All right. So let's talk about what if you're that patient? What are some of the key take home points that you want your doc or healthcare provider to do to be able to kind of understand this better? So one, you want to get labs. You want to get things like a complete blood count. You want to get a fasting glucose. You want to get a thyroid. You want to get a vitamin B12. You want to get other tests that look at potentially an electrodiagnostic test where they see does the nerve function well. And then you want to kind of identify, are there issues with the nerve where you can see there's a mixture of different things like polyradiculopathy or plexopathy. I know I'm using a lot of fancy terms, but I want people to understand how can you empower yourself and be able to kind of take control so that you can be an advocate and you can know how to be able to have a conversation that you aren't just at the whim of someone telling you this is what we're going to do, and you can be actively engaged with saying, hey, this is some of the things that I'm interested in. What do you think? All right. So there's a ton of reasons for peripheral nerve problems besides diabetes. You can have everything from leprosy to sarcoid to rheumatoid arthritis to direct trauma going on. You can have things like connective tissue disease, vasculitis. You can have issues, as mentioned, like alcohol, but celiac disease, chronic kidney disease, gout, hypo or hyperthyroidism, infections like HIV, Lyme disease, inherited disease like Charcot-Marie Tooth disease. You can have liver disease. You can have nutritional deficiencies. You can have Whipple disease. All these different things show up as potential issues with why you might have problems. But one of them seems to stand out and is one of the things that many times as providers, we're not always readily aware of. And these are medications or toxins that can cause a nerve pain issue. So some of these things are going to be things like lithium. They're going to be chloroquine. They're going to be things like amiodarone, statins. You could have issues with chemotherapeutic drugs. You can have issues with amitriptyline. You can have different metals like arsenic, gold, lead, mercury, and thallium, all of which can potentially give a problem and cause peripheral neuropathy. So I have a number of patients that come into my office and they say, before you start putting me on medications or before you start thinking about doing interventions, what can I do in my diet to try to see if I can improve things? And there's 3 different substances that you can kind of look to see whether it might give value. So one is vitamin B. We've taken this from a paper that kind of looked at, is this potentially impactful for peripheral neuropathy or chemotherapy-induced peripheral neuropathy? And what we see is that when we look at vitamin B as a whole, it didn't have any effect on neuropathy incidence rate. It seemed to give maybe some reduction in sensory neuropathy, but it was worse compared to other types of treatments when looked at across all studies. So vitamin B didn't seem, now this is not vitamin B12, this is vitamin B as a whole, didn't seem to make a major impact. Then we look at the aspect of acetylene L-carnitine, which is a utility of a nutritional supplement that can be used to see, can it be able to improve some things? And for those things like chemotherapy-induced peripheral neuropathy, it can be able to reduce the severity. And so that's something that's of use for us to be able to kind of see in these multiple different trials. Now, were the numbers exceedingly high? This one had 409, but some of the rest not documented in terms of the numbers. And then finally, look at vitamin E, and we can see that it did reduce the severity, and it also decreased the incidence in some across some studies where you had 189, 30, 41 different patients that were trialed. So it's a possibility of using nutritional type supplements that can be able to give you some benefit. When we take a look at what are the traditional treatments, normally it's medication oriented. And so what are some of those medicines? So some of those medicines are the following, where you can see things like tramadol, amitriptyline, duloxetine. So these are going to be in the regular names, things like Elavil, Cymbalta, Lyrica, Neurontin, capsaicin, lidocaine. And so some of these things do have utility. Now, they also have some downsides to them. If we look at diabetes in particular, we can see that there's a number of different ways to try to intervene upon this. And we're going to talk about this. One is to try to make the diabetes better by making the sugar better, by making the lipids better, by exercising, by doing different things like TENS, spinal cord stim, or acupuncture. But most people are saying, well, how can we do something that's different that I don't know anything about? Well, there's actually utility for acupuncture as potential treatment for peripheral neuropathy, both in and outside of diabetes. And what they've been able to see is there's different points that can be able to provide some degree of value. Outside of that, now as things are starting to kind of look towards regenerative medicine, there's a number of different thought processes along those lines. But the utility and an adjunct to traditional PRP and stem cells is shockwave therapy. And what they've been able to see is that it's been able to provide benefit for a nerve pain without you having to have a needle or medication. So a lot of improvement in terms of side effects and a lot of other value in terms of not having as much risk. Where you put ultrasound gel down and use a shockwave therapy to be able to provide benefit and changes. And one of the things that we've seen is not only can it be beneficial for carpal tunnel, but for a lot of other things, but certainly for nerve entrapment, that is one of the resulting causes of peripheral neuropathy. There are other ways to be able to treat peripheral neuropathy. Of course there are. And so peripheral neuromodulation or neurostimulation is one of the things that we've always kind of used. So things like suprascapular nerve, genicular nerve, tibial nerve, medial cluneal nerve, and superior cluneal nerve. There are ways for us to be able to place a lead just underneath the aspect of the skin and use an outside either brace or a context of a wrap that can be able to provide external battery to treatment. I want to say this was originally a stem wave picture, which is a type of peripheral nerve, which now I believe is under the name of Curonics. But the fact of the matter is there's multiple different companies that exist on the market where you don't have to have an implantable device into the spine to be able to target the areas that are giving you most of your problems. So now we start looking at, can we be able to heal this? And can we look at this differently, which is one of the things that our clinic is actually looking at in a lot of ways. And so there's been some controversy about it, but there's actually been some increases in terms of like the value that's present. And so one of those things has been the utility of regenerative medicine and nerve hydrodissection. So when you hear that terminology, I know that it sounds super crazy and fancy, but we're going to explain it. In essence, you have these compressions that are present in the nerves that are really squeezed down, and you're not cutting into the nerve. The dissection, which we think about from biology class in 9th or 8th grade, or maybe 10th grade for some of you, is using water under ultrasound guidance to be able to take those areas that are squeezing the nerve, that's quote unquote entrapping it, and being able to release that squeeze. And that squeeze then allows for what was previously mentioned, the areas in and around the nerve, whether it's lymphatic drainage, whether it's blood vessels, or whether it's nerves that actually support the main nerve, to be able to improve its overall function. And the way that kind of looks is that you will actually place the needle in one spot, and you're then able, with nothing but just sometimes water, sometimes some other different substances that are used, basically be able to take this compressed, constrict nerve and be able to improve it. So what most people would say is, well, why is the nerve constricted in the first place? Well, that can be for a number of different reasons. One could be trauma and scar tissue that could be in place. But two, there can be inflammatory processes, as we talked in the fancy slides earlier, that kind of can show up. So are there other ways to be able to provide this in a different way? Of course there are. So we don't always have to use just water. We could potentially use PRP. We can use other elements that can be able to improve the overall function of the nerve, where we can increase what that cellular function of that nerve might be, improve what the wrapping on the other support nerves like Schwann cells happen to be. We can try to see if we can be able to improve that inflammatory ratio that's for a more of a positive dynamic. And overall, we can be able to make things better for peripheral nerves than what we otherwise would expect. What we're starting to see in Europe is actually there's some surgical intervention in a different kind of way for nerves, peripheral nerves. And what they're seeing is elements of nerve grafts, nerve connectors, and nerve protectors to be able to provide ways to be able to make peripheral nerves either less susceptible or heal them from where they've been before. Hopefully this video was of value. For those of you who are joining us here in the middle of May, we just missed this past week, which was Peripheral Neuropathy Awareness Week, that discussed and provided resources for understanding about nerve pain and how to be able to treat nerve pain in a different way. For those of you who are new to the channel, we really appreciate you joining us. Hit the like and subscribe button. We really appreciate you, and hopefully we've figured out and been able to give you resources for how to be able to punch pain in the face and get back to leading the life you deserve. Thank you so much and have a great day.